Well, good evening, everyone. No, I am not Ben Viola. This is yours truly, Keith Reddington. Good to kind of see your name, at least in the chat box. So welcome yet again to the Nutrition and Acupuncture series with the great Dr. Bob Baritz. And we're here tonight again, and we'll kick it right off. Without further ado, Dr. Baritz, take it away.
Hey, thank you so much, Keith. Tonight, I'm going to give you my best program for stopping gallbladder pain. You know, gallbladder is not an issue for every patient, but when it's a problem, it can become a really big issue. I want to give you two cases in point. One was a close relative. Now, you know the type. He never asked me about supplements. He never became a patient. However, when he told me that he was planning to have gallbladder removal surgery, I rolled up my sleeves. I created a video just specifically for him, and I gave him some supplement advice. He took my advice, and over time, the symptoms faded away, and he never did need that surgery. Now, the other was a patient who had, and you have them too, she was good, but she really stopped her nutrition program, and we sort of fell out of communication. Well, she developed, gallbladder symptoms. They became worse over time. And finally, she was scheduled for and had quote unquote routine gallbladder surgery. The surgery was a success, but a few days later, she developed post-surgical clots, which traveled to her brain, and she had a mild stroke. Fortunately, she recovered well, but it was a wake-up call to me. You know, surgery can add a lot of productive, happy years to a person's life. If you ever know anyone who had a hip replacement surgery, you know, they're just so happy with it. But we cannot neglect the fact that anytime somebody undergoes surgery, they are taking their life in their hands and in God's hands and the surgeon's hands, for that matter. So, you know, I need to, and you need to recommit yourself to forcefully and persuasively push your message forward into the community. Reach out to those patients who maybe have fallen off their programs. Reach out to people who are open to your message and show them that they can be helped with these simple, natural systems. You know, it's so easy to take for granted what we do. You know, person comes in with, rapid heartbeat, tachycardia, and it's ruining their life. You know, they're thinking, oh, maybe the person's going to need ablations. And, you put them on a program, maybe did a heart sound recording, and, 3 weeks later, they're coming in, they've got other problems, and the heart palpitations disappeared. You know, it's so, oh, well, what else can I do for you? You know what I mean? It's like, hey, take a minute. You know, people do not realize the trouble that they avoid. And so we can't be so carefree about our message that we take it for granted. So I encourage you to continue doing what you're doing, push your message forward, ignore, the losses and the hits you might take, and work on, helping people with these wonderful, wonderful supplements and remedies. All right, so here is the required seminar disclaimer. The gallbladder. The gallbladder is a small, hollow, muscular organ located just under the liver. The gallbladder collects bile that is created in the liver, and when stimulated, it rhythmically contracts to excrete bile into the beginning of the small intestine via the common bile duct. And the small intestine is called the duodenum. And the duodenum is Latin for 12, and because it's usually, the duodenum is considered to be 12 finger length long, if your finger widths long, if you're measuring it. The jejunum, by the way, is the next part of the small intestine, and jejunum means fasting or empty, and that's because when bodies are autopsied, the jejunum is usually found to be empty. And just to round it off, the Ileum, which is the last part of the small intestine, means entrails. Bile is a thick fluid that breaks down fats into fatty acids, which are then absorbed into the blood along the digestive tract. Bile contains cholesterol, bile acids or bile salts, bilirubin, which is a breakdown product of red blood cells, water, electrolytes like potassium and sodium, and metals. So the gallbladder is an avenue of detoxification. And if you were some intelligent body, some body that was intelligent enough to beat the heart 60 to 70 times a minute for an entire lifespan, intelligent enough to create a whole human body when a man plants a seed in a woman, well, you think that might be intelligent enough to get rid of metals. So the blood filters in through the liver. The liver then filters the metals out: aluminum, mercury, iron, heavy metals that could cause damage, cadmium, heavy metals that could cause damage to the body. It's filtered out. The liver says, well, what the heck can I do with this? Well, the smart body says, well, you know what I'll do? I'll put it in the bile and excrete it into the small intestine, where these powerful metals will help break down foods and then be wrapped up and eliminated through the feces. Amazing. Gallstones. When bile becomes thick, the gallbladder does not empty completely. Sediment can accumulate over time and form hard stones. When the gallbladder contracts around these stones, pain may occur. Although most people with gallstones have no pain, for some, pain can come in acute episodes. If balance is not regained, episodes can become longer, more frequent, and more severe, finally ending up in a trip to the emergency room. Here are the risk factors for gallstones. High estrogen, that's why women are more likely to have gallstones than men. Pregnancy sometimes triggers gallstones, again, because of the estrogen. Overweight, because there's increased cholesterol output. Remember, cholesterol is a large portion of bile. Fast weight reduction, that leads to increased cholesterol being excreted and decreased bile. So a bad combination. Gallbladder stasis, that just means the gallbladder isn't contracting enough. High cholesterol, high blood cholesterol. Advancing age, which is mitigated by a healthy lifestyle. And any type of GI tract dysfunction, such as IBS, constipation, or GERD. Low fiber diet. Fiber does bind cholesterol for excretion in the feces. Here are your treatment alternatives. Avoid fatty foods. That's not ideal, although it does it's what most people end up doing, but then they lose the benefit of vitamins A, D, E, and K. Lithotripsy, which is the breaking of those stones, this is unfortunately only a temporary solution because it doesn't get to the source of the problem. Gallbladder removal surgery, which we already talked about, and now you absolutely lose the benefit of fatty acids and fat-soluble vitamins. Once the gallbladder is moved, the person always requires supplementation to live well. Gallbladder flushes. Well, I do want to tell you this. Flushes do help a lot of people, and I know a lot of practitioners are very successful with them, but they can be quite heroic with various types of symptoms. I even attempted one of myself when I was in my 20s, but I couldn't get that full glass of olive oil down. For those practitioners who can make these flushes work, I think that's great, but rapid flushes are not for my practice. I prefer to support bile production and flow with nutrition and acupoint therapy. And this is the brochure that I've created for your patients. And it will kind of guide them through the acupuncture points, gives them a link to the video, and gives them the nutritional supplements. The first page is how to locate acupuncture points. Terms like anterior, posterior, lateral, medial, what's a soon, which is the acupuncture unit of measurement. And these are the gallbladder points, which we'll cover in some detail when we get to the video. And this is the standard process protocol. And you can see there are only, this is so simple. It's just beautiful. There are only 3 main products. And then there's 3 others to consider. Disodium phosphate if stones are present, Cataplex G if there's high stress, and Congaplex if there's signs of an infection. I'll get to that in a few minutes. And then, of course, here's the disclaimer to protect you and your practice. Now, as an additional resource, I've created, these are the first 4 acupuncture courses, online courses that I've created for your patients. Each course consists of instructional videos, PDF downloads, quizzes, and real-world assignments. The courses include a 60-day email access to me for questions and support. Each course takes about 3 to 4 weeks and costs $199. I've set it up so that if you wish to, you can receive a 20% commission on anyone that you refer to the course from your website or using the code that I'll give you. And you'll receive a 20% commission on any other courses that they purchase over the next 12 months. Let's get to the supplements now. The first one is Betafood. Betafood supports normal processing of fats, supports the liver's natural detoxification process, and supports cardiovascular health. Beets have been shown to have a beneficial effect on the gallbladder, and Betafood makes it easy to take. The next is a choline. The dose is 2 with each meal. Choline supports liver and gallbladder function, supports healthy cell wall structure and function, supports liver detoxification, and supports the nervous system. And finally, for our basic 3 products, Congaplex, which is a source of bile salts. So here's the thing. If a person's having what causes the pain of a gallbladder attack? It's the gallbladder contracting, trying to squeeze that bile out. Well, if you give the patient Congaplex, then the gallbladder can rest because the bile salts are already there. So the person digests fats, the gallbladder can just rest. It just doesn't have to be stressed. The persons get all their fat-soluble vitamins, fats digested properly, and everybody is happy. The gallbladder now has a chance over a few months while they're taking the Congaplex to rest, recover, and reach back to balance. Congaplex also, as I mentioned previously, helps with sleep. Congaplex is triggered by cholecystokinin, which is the happy hormone. And when I can't sleep at night, I'm going to take 3 Congaplex with a glass of water, do my acupuncture sleep points, and next thing I know, it's morning and I'm feeling really rested. So this is off-label for Congaplex, but I highly recommend it. Okay, also consider disodium phosphate. So if stones are present, disodium phosphate is the product to be using. It's not recommended for use with a sodium-restricted diet, and it's for short-term support for normal elimination. What's short-term? I don't know, maybe a month or 2. Cataplex G. This is for people that are really stressed or feel like they're under stress. And stress, of course, has a negative impact on the digestive system, locking everything up, including the gallbladder. So Cataplex G does provide a calmative effect on the nervous system, encourages healthy parasympathetic rest and digest function, supports the liver, supports central nervous system, provides coenzymes and cofactors, contains brain, liver, stomach, and nutritional yeast. Congaplex. Congaplex, if there's any suspicion or any sign of infection, if there's a high white blood count, if they're running a temperature, if they've got the sniffles, if they think they might have an infection, then add Congaplex. So there it is, a beautifully balanced program. Any patient can do it. 3 basic supplements and 3 more add-ons if you need it. I really encourage you to give it a try. Let's keep patients out of the operating room. Okay, here's the video, 3 acupuncture points for gallstones.
Hello. In the next few minutes, I'm going to show you how to relieve gallbladder pain using 3 acupuncture points. A gallbladder attack is often a sudden onset of abdominal pain that gets worse. The pain may last for 20 minutes to an hour and can be accompanied with nausea and vomiting. The pain can be scary and often leads to a trip to the emergency room. Each year, about 1 million Americans have their gallbladders surgically removed, making removal of the gallbladder one of the most common abdominal surgeries. Although you can live without a gallbladder, loss of the gallbladder often results in other problems. I'm happy to report that gallbladder pain and gallstones have been successfully treated with acupuncture points for over 2,000 years, and a slew of recent studies confirm its effectiveness. In this video, I will show you how to locate and activate 3 key acupuncture points to relieve and fortify the gallbladder. I will also introduce my favorite herbal formula for supporting gallbladder and digestive health. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live healthier and happier lives, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first point to help your gallbladder is Gallbladder 40. In addition to relieving gallbladder symptoms, Gallbladder 40 is said to reduce inflammation in the eyes, reduce migraine headaches, and help with foot and ankle rehabilitation. To locate Gallbladder 40, put your index finger on the tip of your ankle bone, then move your finger to a point just below and in front of your ankle bone, like this. Right here. Press into this area and you'll feel a little depression between 2 bones. Locate a spot that is tender or painful or a little sore. That's Gallbladder 40. Activate Gallbladder 40 by rubbing it 5 times rapidly, take a break for a count of 5, and repeat 4 more times. It might look like this. If you have a Tei Shin, you can activate it by pulsing with the spring end like this. Now locate Gallbladder 40 on your right leg and repeat. After stimulating Gallbladder 40, take a few moments and move your toes, feet, and ankles around. Notice if they're moving more freely. The next point is Liver 3. In addition to helping with the gallbladder, Liver 3 is traditionally used to help with high blood pressure, menstrual problems, urinary incontinence, and physical discomforts related to stress. Interestingly, this point has been used for over 1,000 years to relieve epileptic fits. Liver 3 is located on the top of your foot. To locate Liver 3, place your finger between your great toe and the toe next to it. Then move your finger towards your ankle till you're on top of your foot. Notice that your finger is between 2 bones. Staying in that groove, move your finger towards your leg till those bones seem to come together. Press into that location and find a tender spot. That is Liver 3. Stimulate it 5 times rapidly with your finger or the spring end of a Tei Shin. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or it might look like this. During or shortly after stimulating Liver 3, you might notice a sensation of heat or energy in your foot, leg, or pelvis. This is normal and therapeutic. The third and very powerful point for supporting the gallbladder is known as circulation in Sec 6. I will show you how to locate and activate circulation in Sec 6 in a few moments. I would like to introduce you to my favorite gallbladder support herbal formula, Digestive Harmony. Digestive Harmony is one of the most popular herbal formulas. Digestive Harmony, also known as healthy, peaceful herbs, has a well-earned reputation for supporting digestion, intestinal, liver, and pancreas function, as well as promoting vitality and stamina. Digestive Harmony is used to support healthy digestion and intestinal function. It's used after overindulging in food or drink. It's often used during travel to help with new foods and disruptions to your usual routine. It's used to support the immune system, and it's also used to support the cardiovascular system. I put a link below for more information about Digestive Harmony. Circulation and Sex 6 is located 3 finger widths below the wrist crease. To locate circulation in Sex 6, look at the palm of your hand. Notice the wrist crease. If you have more than one wrist crease, select the crease that is closest to your hand. Place your left hand in the center of the crease with the first knuckle of your small finger in the middle of the crease. Then notice the spot that is just below the first knuckle. To locate circulation in Sex 6, take 3 fingers of your left hand and place it just below the center of your wrist crease. At the bottom of those fingers, in the center of your arm, is circulation in Sex 6. That would be right around here. This point is best treated with a gentle tapping with your finger or the round end of a Tai Ching. Tap rapidly for 5 times, take a break for a count of 5, and repeat 4 more times. With your finger, it might look like this. Now, if you have a Tai Shin, it might look like this. If you're having gallbladder problems, I suggest that you try these 3 points 3 times every day for the next 30 days. And be sure to check out my video, Heal Your Gallbladder Naturally, for additional steps that you can take. I put a link below for this video. Please feel free to comment below on any subjects that you would like me to address in future videos.
All right, so that completes our video and our discussion of the really 6 remarkable standard process products to help people with gallstones or gallbladder pain. So, Keith, any questions I can answer?
All right, well, let me take a peek here. I don't know if you'll be able to answer them right off the fly, but let's give it a shot. Maybe when you were talking about, I think, Betafood, she was asking why not AF Betafood? Yeah,
great question. You know, I researched that myself. AF Betafood is, it's, I won't say it's a water, it's just a less potent product than straight Betafood. And so I'm not exactly sure why they created it, but to get the same effect, you would have to use a lot more AF Betafood tablets. So I prefer to keep it to the more powerful product, less tablets for the patient.
Very good, very good. I would agree with that one. And if anybody's interested, I did a webinar. This was got way back when in 2020, maybe April, May, June, somewhere around there. It was called Give Me a Beat. And it was the difference between AF Betafood and Betafood. So I did a PowerPoint for that. So if anybody's interested, I will send that to you. All right, Dr. Baritz, I think we have one more here. Okay, so actually a couple more. How long would you use protocol for? This is from Debbie Sigeti. When using Congaplex, how long can this be used for?
So I would use the protocol, you know, for as long as they're having, you know, gallbladder problems. There's no end time in this particular protocol, but for a lot of patients, it will, they'll kind of get through it and they'll be better. And then they may need like a lower dose, you know, for a longer term, but there's no problem continuing the protocol. Congaplex, you know, I think, you know, 2 to 6 weeks is really the window. And then you really should have, the issue should have been resolved by then.
Okay. Good answer. All right, this is from Constance Green. Hello, Constance. So why is this circulation and not pericardium 6?
No, that's a great question, Constance. Let me say that the acupuncture meridians have so the same meridian has different names. For example, the direct Chinese translation for this particular meridian is heart constrictor, because the pericardium does, circle the heart. But here in America, I don't know, in Asia, heart constrictor might sound like a good thing, but here in the US, heart constrictor just was not a real appealing sounding thing to be doing. And so they did switch it to, so pericardium 6 is another name for it. And but I prefer to call it circulation in sex 6, because I think circulation in sex 6, because that really describes what your patients are looking for, that it really does help. So it absolutely helps the circulatory system, and it has a profound effect on the reproductive hormones. And so I like that name, and so that's why I call it that. But it absolutely would not be wrong to call it pericardium 6.
Perfect. Thank you for that. Okay. I guess the hot topic is choline and lecithin. We'll get to it. I would love the beat PowerPoint. All right, everyone. So what else? So Constance is adding, what if you add Zypan?
Great product. I mean, Zypan doesn't really impact fat digestion, which is the problem. But, the fact is, they probably have other digestive issues. So, if they're willing to take more, I think Zypan, I love Zypan, and I give that to almost every patient in my practice. So I think it's a great idea. I usually muscle test when patients come in. I'm going to muscle test digestion and either give them Zypan or Enzocor, whichever one tests the best.
Perfect. Yeah, I mean, where would we be without Zypan? You have to ask yourself that question sometimes. The thing with Zypan is, yes, there are some small contraindications if somebody has an ulcer, et cetera, but hands down, I mean, people just do well on Zypan.
Yeah.
It's an amazing product. Okay, let me see what else we have here. I think that was actually it, Dr.
I do want to
Baritz.
share, since I want to share one quick story for anyone. So I attended a nutritional seminar for psychiatrists. I'm not even sure how I even got in there, and they probably would have ridden me out in a rail if they knew my thought. But somehow or other, I was in this seminar, and all around me were the psychiatric nurses and psychologists and psychiatrists. And so the speaker was up there it was because he was a nutritional guy. So the speaker was up there talking about digestion and mental illness. And he said that people who have low hydrochloric acid in their stomach have a higher frequency of mental illness. And he found that if you could simply solve the lack of hydrochloric acid problem, you could then greatly help this person. And he lamented the fact that there was no test available. Well, that was just around the time I did my IFNH, International Foundation for Nutrition Health, course, and got my certification there. And those of you should know, and if you don't know, we can send you the link. But there's actually a point that you can just press on with your finger just up under the ribs. And if it's sore, they have low stomach acid, and you can treat them with that Zypan. This is one more thing that we'll leave this little thing alone. Can you imagine if there was a test that could check for potentials for mental illness and provide a simple, remedy that's under, $30 a month? That's extraordinary, and it's revolutionary. And you actually have it in your hands. As I like to say, we'll leave the Nobel Prizes to people creating new drugs and whatever, but it's the holistic professional, like the people on this call, who are really doing the hard work. And, it's my job and Keith's jobs and Ben's job to provide you the tools to do, miracles as usual.
That's great. Well, Dr. Baritz, that was the last question. And just to dovetail off of your story there, Zypan. So it's interesting, if you break down what is in Zypan, it becomes more and more apparent that Dr. Lee had an understanding, or at least an appreciation for Chinese medicine, because what he put into a digestion formula, essentially a stomach product, was spleen. So most TCM practitioners go, he was a smart guy. So you've got the stomach support from the acid, and then you have spleen, which are typically paired very well together.
And of course.
Well, that's all I see on my end. I think that's probably it.
Great.
Well, Constance added in maybe for a future webinar. She wants to know if we can discuss addiction.
Okay, I did make a note about that. And hey, next webinar coming up, I'm thinking vagus nerve. Vagus nerve stimulation. This is the core of healing. So anyhow, email me if there's something else that you want, but I'm thinking next one will be vagus nerve. Addiction, I do have a great protocol for that too. I'd be happy to get into it.
Very good. All right, Dr. Baritz, on behalf of everybody else, we'll thank you once again for a great informative webinar. What are we at? 7:06. So these are concise and we get everybody into their evening. So everyone, thanks for joining in. We'll see you all next week, and have a wonderful night. Take care.
Good night.